Elder Justice Act, Patient Protection and Affordability Act. 11% of Americans over 60 have suffered some sort of abuse in the last year. The National Center for Elder Abuse defines abuse as any intended or careless act that causes harm or serious risk to an older person physically, mentally, emotionally, or financially. This pie chart shows who most frequently abuses elderly people. It would be their son and daughter, and then other people that they're familiar with. The Elder Justice Act, signed into law by President Obama in 2010 as part of the Affordable Care Act, provides federal resources to prevent, detect, treat, and understand and intervene where appropriate, prosecute elder abuse and neglect and exploitation. Part of the law made it easier procedurally to prosecute people who are guilty of elder abuse. Prior to that, it was much harder to get someone found guilty. It requires covered individuals to report abuse, and we are covered individuals because we work for a healthcare facility, and we should not fear being retaliated against for reporting any elder abuse if we do it in good faith. EJA applies to us because, as I said earlier, we are a healthcare facility and mandates that we report a reasonable suspicion of a crime against a resident to HHS Secretary and our local law enforcement agency, Sleepy Eye Police. So who all must report? Owners, employees, operators, managers, agents, contractors. What kind of crimes? Violence, assault and battery, sexual crimes, financial exploitation, theft. Crimes must be reported within 2 hours if there's extreme pain, risk of death, or anything requiring medical intervention or sexual abuse. 24 hours would be all the other reasons. If you fail to report your reasonable suspicion of a crime, you may pay a penalty up to $300,000. See the notice in the time clock room for more details. And you can see I have the notices left of the blue hand up on the top row. So on that notice, it has the phone numbers of the Department of Health and the Sleepy Eye Police Department. You can file your own report, and Divine can file their own report, or you can go under the report that Divine files. It's up to you. The end. Equal employment opportunity. We follow the law about equal employment opportunity, and the law is about not discriminating. So we do not discriminate or harass employees or applicants because of race, color, national origin, religion, genetics, financial status, sex, pregnancy, disabilities, sexual orientation, age, marital status, and military service. We also cannot discriminate in hiring reasons, discharge pay, fringe benefits, job training, classification, referrals, religion. We need to accommodate people's religious practices, and disabilities. Again, we must accommodate that as well. A business can't retaliate against you if you file a charge of employment discrimination. So what to do if discrimination has occurred? Contact the Equal Employment Opportunity Commission, and you can find that in the phone book under U.S. Government. We also have it in the back on the bulletin board under all the government information we have there. There is a time limit to file a claim, and we have a website which is www.eeoc.com. Thank you. Personal appearance here at Divine Providence. We expect that you'll practice good personal hygiene. You'll shower and bathe, have good mouth care, hair care. If you wear makeup, make it conservative. Beards and mustaches should be maintained. Fingernail length should be short enough so it won't harm anybody. And if you have it polished, it should be maintained. Your jewelry should be conservative so it does not cause an infection control concern, does not create any safety hazards. No large rings, as few rings as possible. Must wear studs versus hoops in body piercings. That's for you so someone doesn't grab it and pull it out. You should be neat and clean. Long hair should be secured back with a rubber band. pins, whatever. The length shouldn't interfere with your work. Pull back your hair if it does get in the way of your work. Kitchen employees must wear a hairnet when in the kitchen and serving food, and they need to cover all of their hair, including their bangs. Clothing, okay, nursing, dietary, housekeeping, laundry, bed makers must all wear scrubs. The scrub should be clean, in good repair, and the pants must not drag on the floor. They should not be too tight or too loose. They must cover the knee. No shorts. You can wear capris, but they must, again, cover the knee. No skid shoes, closed-toed shoes. No colored underwear under white clothing. Name tags. Maintenance must wear blue mechanics uniforms, non-skid shoes, and name tags. Office staff should wear clothes that are clean and in good repair. No tank tops, no shorts, no low-cut tops, no colored underwear under white clothing, and they can dress up for holidays, and a name tag. The end.